But first, with the National Cabinet having what's now been dubbed an emergency meeting on Monday, a big question for the new government is whether it wants to keep treating COVID as an ongoing crisis or start treating it as just another disease. Don't underestimate the power of the crisis mongers, citing more than 10,000 deaths since the start of the pandemic, more than 40,000 new infections a day, and more than 4,000 people across the country in hospital. There's plenty who'll whip up fear and panic. There's the epidemiologists who none of us had ever heard of before the pandemic. There's the state premiers who've loved their time in the national spotlight. There's the businesses that have had billions in COVID subsidies. And the workers who've got to work from home and picked up extra COVID cash. As well as that, there's the health sector that's got a new bogeyman to blame everything on if it isn't working in the system, whether or not it's the fault of COVID. Thanks to the one-size-fits-all JobKeeper payments, many people actually had more money in their pocket during COVID, particularly casual workers, while not actually having to earn it. So you can see, can't you, why so many want the system of crisis to continue. But at some stage, normal life was going to have to resume, simply because no government could keep paying people to stay home, keep schools and workplaces closed, and generally stop people living for fear of dying. Especially now that more than 8 million Australians, a third of our population, have actually had COVID, and for the vast majority, it's been a relatively mild illness, a head cold, a fever, a few days of feeling low and lethargic. The sort of thing, now that we've got such high vaccination rates, 95% of us double vaxxed, 70% triple vaxxed, that we take a few Panadols for and stay in bed. With vaccination, this is not the disease it was 2.5 years ago. Vaccination has greatly reduced the risk of severe illness, hospitalisation and death. Since coming to office, the Albanese government has ended the $750 a week payment to workers forced to isolate due to COVID, and it's about to end the free rat tests for those on welfare. Now, it's these two changes that have made the state premiers angry, and the unions. It's also got the federal opposition raising concerns, even though it was the Morrison government that first slated that all of these things would end back in March. Now, as a taxpayer, I hope the Albanese government stands firm. The end of endless spending and constant restrictions has got to end. The work from home demands must end if our CBDs are to recover. The mask mandates or even recommendations to wear them, they're going to end too if normality is to return. Now, if people want to work from home, let them sort out that with their employers. If people want to wear masks, fine. But don't expect the government to make them compulsory, given they're inconvenient, hard to wear properly and not entirely effective anyway. Now, right now, masks are optional on flights to London, but compulsory on flights between Melbourne and Sydney. So it's hard to say there's any science in all of this. There's just different levels of bureaucratic officiousness. Now, I'm not saying that COVID shouldn't be taken seriously, and I'm certainly not saying that we didn't need to be tough early on. We did. Once the Victorian government in particular had lost control of things in that first year, 2020, I was one of those who supported the tough measures, but not since then and not now. In a speech reported today that he's given overseas, Scott Morrison has defended Australia's COVID response as world's best. He noted that it probably saved 40,000 lives. But with federal government spending alone over $300 billion on COVID measures, well, that works out to $7.5 million for every life saved. 7.5 million per life. Not to mention all the other costs that restrictions caused. The lost school years, the suicide rates, the other illnesses that we didn't adequately treat, the mental trauma with enforced isolation. Now that vaccination really has turned COVID into not much more than the standard seasonal flu, we need to start treating it in much the same way. If people are too sick to go to work, they should stay at home. If people are off work, well, there's standard sick leave. And if people choose not to be vaccinated, however unwise that is, Well, that's really their business. And outside of health workers, maybe it shouldn't cost them their jobs. I think now, we keep saying it, don't we? Let's live with this virus. I think now we've really got to mean it.